hi, can you state your name and currently what profession you're working in now?
Okay, my name is Fiona, and I'm currently a HR advisor, so at a public hospital.
All right. So, first question, what are your hiring policies in regards to dress code, particularly in terms of tattoos?
So we don't discriminate from the paper. So when people come in and they obviously for interviews, then that's the first time we see them. and after that, we make sure that they understand that tattoos have to be covered up, piercings have to be taken out. So obviously that's an agreement towards the end of the hiring process. It's not rather at the start. So we help them understand why, but obviously don't overwhelm them to start with. That's all I can say about that one.
Right.
So there's no discrimination there.
Do you make it explicitly clear to your potential hirees from the start that these policies are there and explain why it's implemented?
Only if they have very visible and very significant amount of tattoos or piercings. And yes, then that's when we make it clear, especially if they're going into a clinical role whereby they're patient-facing and there's a lot of, for example, surgery or any other clinical role, to be honest. So that's when we are looking at really advising them to, if they want the role, they'll have to adhere to our policy.
Do you currently have anyone employed with tattoos?
Yes, there is. Not many. In clinical areas, there's definitely not many. I would have to say that a lot of them are either covered up already or in areas that we don't really see. But for example, really on the arms or on the necks, we ask them to cover up. And if there are in non-clinical areas like administration or other areas such as where I am now, we also see whether it's big enough to cover up. If it's not significantly interfering with people's work, then we don't ask them. So,
right.
Yeah.
Has there been anyone who has tried pushing the dress code when it comes to tattoos?
Yeah, there is, but obviously they don't push very far. They don't get very far. So I do remember one case whereby a nurse wanted to, with a very significant amount of sleeve, wanted to actually wear short sleeves, but obviously it's not considered visually pleasing or visually pleasing in the sense that it's not very considered clean or hygienic, and so in the end he wears a sleeve over the sleeve. So that's as far as it got. So he could still wear short sleeve, but he just has to wear a tube. So.
All right. Why do you think such rules and guidelines exist?
According to our policy, it's for the brand image. So even for, especially for a hospital, we're not really gaining profits or anything, but we are making sure that our patients are coming to us and making sure that we seem clean-cut, professional in that way, conservative, in that they'll be treated with a degree of respect. But obviously, in terms of work health and safety, that's another idea. We don't know how hygienic the ink are or the markings are, so we ask them to cover up as a work health and safety issue. So that's both of that.
Right. Do you personally agree with these guidelines?
I don't really mind because I see a lot of people wanting individuality and to a degree, and I think what the bigger organisation's concerned about is having everyone obviously being safely in the brand image. But for me personally, if I see a colleague having a visible tattoo or something like that, I won't feel intimidated or anything. It's more just, this is you. So yeah, personally, no vendetta on that one.
Do you think culture plays a part in these impressions of tattoos?
Yeah, I believe so. Especially in a health setting, it's directly, if not, it's directly opposing the sense that obviously, you know, what the image of a tattooed person presents as versus, you know, a clean cut, healthy adult with a degree, for example. So there is still a lot of stereotyping there. The other thing I could think of is obviously I've worked in other areas too, and if it's not for example, retail, they don't really care if depending on what you're selling. So there are retail places where tattoos are quite encouraged, and I've been there. But most of the places they require a degree of cover up and a degree of uniformality. So yeah.
Do you think there will come a day in the future where tattoo stigmas will be abolished, or at the very least be better than it is today?
I'm not too sure if there's much of a tension in the workplace at the moment. So if it's to be abolished, then somebody has to push for it. And but it seems to be quite a not so much of a bigger issue. There are other issues like gender, basically age gaps or anything like that in the HR domain. That's a little bit more attention seeking. But tattoos, I believe there might be a day when someone, you know, obviously thinks, okay, there are no more issues, let's look for one more issue. And I think that'll be the day. It's not higher on the priority as the other ones.
Right. All right, thank you so much for your time, and yeah, we hope you'll move for this advocate of more freedom of tattoos in the workplace.
More freedom.
All right. And
Thank you.